Welcome back to Season 6 of the Group Practice Accelerator podcast, brought to you by Polaris Healthcare Partners, where we leverage decades of healthcare and business experience to drive growth in successful group practices just like yours. If you're a healthcare entrepreneur and you're interested in building, scaling, or exiting your group practice, you've found not only the industry's leading resource for business education, but a team of trusted advisors dedicated to helping you achieve and exceed your goals. In short, the team at Polaris creates clarity, confidence, and results. I'm your host, Jamie Falasz, and the Group Practice Accelerator podcast is on the air. Hey everyone, thanks for joining me again this week. I'm really excited about this episode because we're going to cover a topic that touches each and every one of you, and that's real estate. Every founder either owns it, is looking to own, is looking to sell, looking to lease, thinking of adding locations and needs land or space. So real estate is really an aspect of healthcare that we all need to be knowledgeable about. And of course, we want to provide you with all the best resources available in the market. And a bit selfishly, it's a topic that's of particular interest to me because for those of you that know me, you might recall that I have a handful of years under my belt as a paralegal, a good chunk of which was spent supporting real estate transactions for the firm. And although I mainly was residential, I got to dabble in commercial a little bit. And that came on the tail end as I was kind of winding out of clinical practice. But anyone that's been in dental knows that you may never leave dental. And our lifers know that once you're in, you're in. But in any case, real estate, particularly healthcare real estate, deserves a lot more attention and discussion because zero elements of your strategic plan can come together without it. So today, to help us better understand why and how healthcare real estate impacts you and your future plans, is Ryan Gillespie, Regional Director at CARR, the nation's leading provider of commercial real estate services for healthcare professionals. Ryan, welcome to the show.
Glad to be here. Thanks for having me.
Well, good. I want to dive into this, but first, I want our listeners, those who might not be familiar with you, to learn a little bit about you, your career, and a little bit about CARR as well. Can you fill us in there?
Absolutely. As mentioned, I'm Ryan Gillespie. I'm a regional director with CARR. I cover our Midwest region. We have, 5 regions in the company, and I cover what you would think of as the Great Lakes states for our company. So I've been with CARR 5 years. I'm licensed in both Michigan and in Indiana. So I still transact. But mostly my job now is to serve all of our agents in our Midwest region, as well as around the company, to make sure all of our agents are set up properly for each deal and have all the resources that they need. So yeah, I've really enjoyed this industry. Prior to CARR, I was actually in still kind of a brokerage model, but I was a headhunter for high level, like engineering, technical placements. So, I did that for 13 years. And made a switch about 5 years ago to come into healthcare and dental. You know, I didn't have any experience in commercial real estate or dental, but made the leap, and I've really enjoyed it. And it's been a great change for me. And CARR itself is a great organization. It was founded in 2009, and the calling, I guess, for CARR is our owner and CEO, Glenn Carr.
Mhm.
He worked in commercial real estate. He actually worked on the other side, so we do buyer tenant only for healthcare. He worked for a large commercial real estate brokerage that did full service.
Okay.
And while he was there, he saw a lot of dentists going into commercial real estate deals without representation or maybe under representation, and saw that there was a need for dentists who have a representation on their side of the deal to level the playing field. So company went national in 2015, and now we have agents in 49 of the 50 states. Hawaii is the one. We don't have representation at this moment, but that could change this year. So yeah, we've scaled and had a lot of success around the country.
Raising my hand to go to Hawaii.
That sounds like a good one.
No, I'll stick with Scottsdale. I'm pretty happy here. But 2 things. We're glad to have you in healthcare and dental. You may not leave now. You are stuck with us. And secondly, that brings to mind a question. Why is it important to have representation?
Yeah, that's a great question. There is a lot at stake in these deals. A properly or poorly negotiated commercial real estate deal can benefit or cost a practice $100,000, $200,000, We've had some deals where maybe it's a little less. We've had many deals where it's more. I've had multiple deals in the last year where we benefited a dental practice over a $500,000 on a commercial real estate transaction. So our goal is to give you peace of mind that you got best possible terms on the deal. And that's worth something when your head hits the pillow each night that you had somebody who was on your side of the deal, no conflicts of interest, and help you achieve best overall terms. So there's a lot on the line, and a lot of these landlords, developers, they're very sophisticated. They're very prepared, and they have proper representation. And if you don't have someone on your side to kind of help level the playing field, it can be a tough go in some of these deals. So that's our role, is to help level that playing field in each and every one of your deals.
Very good. Somewhat of a rhetorical question, but I wanted to make sure we covered it because the right representation can save you a ton of money, like you said.
Absolutely.
Yeah, and get you through the deal a lot more smoothly too. So, our listeners are looking to increase their enterprise value at the end of the day. So, that careful selection of land, buildings, location, and community are really critical points. So, I kind of want to frame a lot of our conversation today around that. Um, and I'll start with this. Like, what are some of the most critical elements that go into location selection for an office? I'm thinking de novo versus moving versus acquisition. And maybe if I even get more specific, meaning when we're looking at a specific market, maybe pick a city.
Nashville.
Okay, here we go.
Sure. No, that's a great question. I'm not sure why Nashville came to mind. That is actually a growing
Yeah.
market in the U.S. But
Yeah.
I think the as far as location goes, I think one of the first questions really to ask is, as a practice owner, whether it's de novo or through acquisition, do you want to lease or do you want to own your real estate?
Okay.
Because the answer to that question can help sort of set the direction for the rest of the deal. So, truthfully, there's not really a right or wrong answer. It's really about what the practice owner, business owner wants to achieve. Some are seeking equity, others are seeking cash flow so that they can continue to reinvest that cash flow into new businesses, acquisitions, whatever it may be. So once we get that answer, that can help set the direction. I think another question to ask really is, what type of dentist are you? Are
Okay.
you a general dentist? Are you a periodontist, an orthodontist? Are you growing your practice through visibility? Having a highly visible location with a big pylon sign to kind of acquire patients that way? Or are you growing your practice through referrals? So it's maybe a little less relevant for you to have a front facing location. That can play a critical role because, as you could imagine, real estate values fluctuate heavily based on kind of retail high visibility locations versus maybe office or medical office building locations that are set back from a road, or not as much traffic, that kind of thing. So
Okay.
another piece here that is critical and is often overlooked is the zoning master plan for a particular town.
Oh,
What is happening in that town? What is Nashville
yeah.
doing? Where is it growing? Or where is it maybe, where are they maybe loosening up their zoning to allow more of a variety of businesses to enter a certain market? So having a better understanding of your zoning and master plan is critical. And that is a commercial real estate agent's job. It's kind of maybe lower on the job description, but it's getting to know a particular town, their master plan, what zoning is doing, what they're trying to achieve, where they're trying to grow, how they're trying to grow. And then, yeah, I think just kind of getting to know who are the other businesses nearby and how can those businesses sort of influence the aesthetic of your business and
Yeah.
traffic and flow and those kinds of things. So it's really kind of a holistic approach with getting to know a particular town and zoning, and also balancing that with what the dentist or business owner wants to achieve with their practice from a profitability standpoint.
Yeah, because I can see how that varies from urban to suburban to way out in the sticks. What if you're in the city and you're tucked into a building? How do you get good visibility there? That's certainly a question. What about parking? These are all things that come to mind when I think about choosing real estate and making it easy for patient access. Are patients walking? Are they driving? All things that kind of pop into my head. And I'm sure I'm missing dozens of things. This is your field of expertise. But just some stuff that comes to mind, like some of those elements, critical elements that go into selection. And, let's talk for a minute about lease versus buy. And I know that depends on the founder and what they're looking for, but is there a benefit to one over the other?
That is the $1 million question. That is probably the most frequent question we get from docs that we're meeting with. And should you lease? Should you buy? Truthfully, it depends. There's not a one size fits all answer, and I think a lot of it has to do with location.
Yeah.
Where are you? Are you in Nashville? Uh, if you're in Nashville, it's going to be very difficult for you to purchase, and if you do, it's going to be costly. Land values are quite high; they're quite in demand. You're going to have lots of competition for other competing businesses who also want to buy that lands. You're certainly not going to get a deal, so that's something to consider. Or are you in a smaller town, say South Bend, Indiana? In that event, there's land available and it's affordable. Uh, Oftentimes construction costs can be a little bit more reasonable. It does depend on location, but I think once you get beyond that, leasing can be very nice for flexibility, for quick turnaround. It can be quite nice for getting costs offset. Oftentimes, a landlord or developer can help cover a lot of the costs for construction, which can reduce the burden for the dental practice.
Okay.
So there's lots of flexibility, although there's lots out of your control too. You've got to negotiate a lease rate, and that lease rate typically escalates every year,
Yeah.
and that needs to be renegotiated every time that lease expires. And that's just something that you can't necessarily control. Now, that is where we come into play, and we can help you properly negotiate a deal. But it is something that it's generally understood that lease rates are going to continue to go up. You
Yeah.
know, but if you're able to purchase real estate, there can be lots of, I guess, control that you're now inheriting because you own your real estate. You can control a lot of your costs that go into it as well. And there could be very nice tax benefits that come along with it as well. And when it comes time to selling your practice down the road, owning your real estate can be quite nice as well because you can continue to lease your real estate to whichever dental owner now runs your old practice, and that can be the gifts that keeps on giving.
Yeah.
So that can be quite nice. So it all depends. I meet with clients that are really focused on cash flow. Those clients, it doesn't really make sense to sink a bunch of money into buying real estate because they want to keep growing their practice, keep that fuel there. Whereas I work with other dentists who are really focused on net worth and equity. And for those clients, they're all about purchasing the real estate and having that equity, having that piece to kind of help impact the profitability of their practice. Part of my job, this is the last thing I'll say on this, is to kind of get to know each client. I want to know who they are, what they're about, what their goals are. It doesn't have to be a too heavy of a conversation, but within 5-10 minutes, you can learn a lot about what things that they want to achieve, and then based off of that, then we create a model because it's not my deal. It's the
Exactly.
dentist's deal, and we need to make it start there.
Yeah, and they've got a plan in their minds, hopefully, because that's really critical to, setting up any of this to figure out if they should lease, if they should own. By owning, like you said, that gives you a nice passive income long after you exit, if that's what you choose to do. So benefits to both. I love that you get to know your clients and start there. Now, I'm thinking about the inside of the building. Assuming you're buying an existing practice or a group of practices, what do I need to think about inside the building if I'm buying, let's say, 3 dental locations? What are some critical things that I need to be looking for?
Yeah, that's a great question. I would say, what is the condition of the interior space, the interior build out? Is
Mhm.
it a gray box, gray shell, or is it already built out for dental? Is there already plumbing? If there's not, that may require trenching of concrete, which does cost money. That's just going to be something that adds to it. If it is already built out for dental, what is the condition of the build out? Is it dated? Has the last update been from 30, 40 years ago? If so, you're going to need some cosmetic updates. I think the name of the game really is getting to know the interior space, and the very next question is, what is it going to cost to get that space up to your standards
Okay.
to run a business? So once we know that cost, we can now, as we're structuring a deal, we can go to the landlord and request for them to give us what's called tenant improvement allowance, which is money from the landlord to you that goes towards the construction of the build out. Because ultimately, they own the building, and this construction is going to increase the value of their asset. So
Good
they
point.
should participate in the some of the construction costs, not all, and that's going to really help you start off on the right foot as a practice owner in a new location. And what's interesting is there's been several studies done, and they state that the top four reasons a patient returns to a practice. Number one is your facility. Two, front desk staff. Three, support staff. Number four is the doctor. And that's no slight to the doctor, but what it does
No,
say though
but
is, what does your space look like? Is it
yeah,
nice? It doesn't have to be bougie. This isn't saying that your space needs to be, mossy walls and waterfalls and things like that, but it
yeah.
does need to be clean and it needs to look nice. Your build out needs to be clean. It needs to look good, fresh.
Yeah, something updated, something
Yeah,
attractive to
yeah,
patients. But yeah, no slight to doctors at all, but we're visual people. You open the front door to somewhere. Do you feel welcome? Does it feel clean? Good points. Very good points that you made there. And on that note, how do you work with other vendors? Let's say I'm buying 3 locations and it's kind of a disaster and I want to gut all of
yeah.
it and start over. Do you work with vendors? Do you have some people that you trust? We work with a lot of manufacturers in the industry and distribution companies as well. And I assume you do the same.
Absolutely. So this is a critical component for each agent in each market across the United States, is to get to know the vendor community in each and every market. So for example, let's just, to your point, Jamie, let's talk about general contractors.
Yeah.
My job in the markets I transact in is to know who are the general contractors in that market. Number one, that have experience doing dental. Okay. There's lots of contractors out there that want to do dental,
Mm.
but don't have experience doing dental. And they're going to make it appear as if they do dental, but they don't.
You want to
um,
see that work, just say, yeah, I
so
want to
you
see what you've done.
Amen.
Yeah.
So the critical piece here is for me to get to know all the general contractors that actually do dental, and I want to get to know, to your point, Jamie, what have they done? What are
Yeah.
the dental offices they've worked on, the interior build outs, the ground up projects, and what is the depth of their knowledge within dental? So number one, who does dental and who does it well? Two, who actually is reasonably priced? Who gives a quote or an estimate up front and follows through on that estimate through completion of work? And
Oh,
who follows through on time, because there's lots of contractors out there that kind of do the smoke and mirrors approach up front. And then once it comes down to the brass tacks, it's not what you thought it was going to be. So over time, you start to see the contractors who actually mean business, and then the others who maybe you want to stay away from. So when we're working with a dentist who's doing a interior build out or a ground up project, whatever the scenario may be, when we're making those recommendations of a general contractor or two or three, these are properly vetted vendors that we've been there, we've done that, we've tested them to see what their work is, and those recommendations are an extension of us. So we want to make sure that they are great people that have the dentist's best interests in mind.
yeah, good point. And frustrating as it can be for things to have, be delayed, this is why we rely on people like you because it's not just frustration. That frustration will cost you money in time delays, things like that. So, and everybody's got, a friend of a friend or a brother-in-law that I think they can save some money and let's do the construction, through him. But you want someone who has created a dental practice before. They understand workflow. They understand, what Ryan's aiming to do for his client. So these relationships are really important. Although we really know most of us say, where can I cut costs? But going outside of someone who specializes in dental in terms of vendors, not a good plan. You have to go with the experts here.
No doubt about it.
Okay. So on the cost front, I know that listeners are going to ask about this. Will hiring an agent cost them money? And could not hiring an agent cost them money? I guess I should ask the inverse as well.
No, that's a great question, and also very common scenario for people to be curious about. So, what's interesting is in commercial real estate, similar to residential, the real estate commissions are often paid by the seller or landlord. So, if you're a landlord and you're leasing a space, you're going to hire a listing agent. They're going to negotiate a gross commission. Usually it's 6%. So it can go up and go down. But what happens is when a buyer or tenant, in this case a dentist who's looking to lease or purchase real estate, when they hire an agent to represent them, that 6% gross is being split with the buyer agent. Okay, so 3% to the buyer agent, 3% to the listing agent. And I bring this up because the economic terms of the deal aren't changing for the landlord. They're prepared to pay 6% either way. So really, it's either 6% going to the listing agent or 3 and 3 for both agents. Landlord's paying the same amount. So you might as well hire representation to help you properly evaluate the space, negotiate a deal. I keep track each year of the savings I have for my clients on each deal, and I do an average at the end of the year. And oftentimes it's usually around 100, $150,000 on every deal that
Wow.
there is negotiable. You're not paying us a commission. We're helping advocate, negotiate for you to the tune of tens to hundreds of thousands of dollars. So yeah, not hiring an agent can cost you money is the way I look at it.
Well, it's that scenario where you don't know what you don't know, and you cannot be an expert at everything. I've mentioned this before. We don't cut our own hair. You go to you go to the experts. Crude analogy, but it's true. We use experts because they are experts. They save us time, they save us money, they save us headaches, you name it. So we want to rely on the experts here. And like you said, you've got that 6% built in.
And let's just pretend you did pay us a commission, which isn't the case. But
Yeah.
let's say you had to pay us 3%. Oftentimes, I mean, I just told you, 100, $150,000 is the average savings I've had from my clients. The 3% commission is a drop in the bucket, but that's actually not even the case. The landlord seller is covering that. It's definitely in your best interest to have an agent on your side of the deal who has no conflicts of interest and has no ties to the seller or landlord.
Yeah, fair point. So if I have my strategic plan in place, let's say we have a client who plans to grow to, 20, 30 locations, maybe they're sitting at location 2 or 3. At what point should they reach out to a car agent?
That's a great question. It depends on the style of the deal. If they're open to doing a lease space, I would say around a year in advance, just to
Okay.
give us enough time to negotiate and have posture in a deal, as well as time for, you know, permitting and construction plans and construction, delivery of all the fixtures and furniture and displays and all that. So I'd say at least a year. And if you really want to, get ahead of the game, 18 months is perfect. It's better to be early to the party than late. But
You know,
if yeah, sorry, go
for the
ahead.
sake of clarity, does that mean, because I want to make sure our listeners understand, does that mean a year or 18 months from the day that they plan to open their doors? Or
Yes.
from what? Okay, got it. Thank you.
Yes. There should be enough time there. And that's for a lease. If you are looking to buy real estate where there's going to be, significant construction or even buy land, do a ground up project, I would suggest 24 months in advance, 18 to 24 months at a minimum, just to give us enough time so we're not, kind of in a 2-minute drill the whole time where everything has to be perfect. It's nice to have a little bit of breathing room over the course of the deal.
Exactly. Okay. So, last question. Give me a good scenario where car can help. I like a little story to wrap things up.
So I'll try to add a little story in here, a little flavor. So, startups, relocations, expansions, purchases, additional offices. If you have a lease renewal, if you're already practicing as a dentist and you have a lease expiring,
Oh,
that can
yeah.
be a critical deal. That's often one of the most overlooked transaction opportunities from a doc.
I
They
would
have a
not have
10-year
thought of
lease.
yeah.
Yeah, you sign a lease, it escalates for 10 years. It's not hard to be off market over the course of 10 years of escalation. So when that lease expires, that is a negotiable transaction. Landlords will try to pin you and kind of make you feel like, you just sign the next lease and let it continue to escalate.
Yeah.
They'll send cookies to your office or whatever they're going to do to kind of warm you up and make you feel good about, signing that extension. That is a negotiable transaction and you know, um, you want to get involved at least, 24 months in advance, 18 to 24 months in advance to start planning for that renewal.
Okay.
So the last transaction opportunity is a practice acquisition. If you're looking to buy a business, a dental practice that's for sale, an often overlooked scenario is that although you're through an asset purchase agreement, you're buying this dental practice. There's also a real estate deal, and it is negotiable. You're either leasing the space from the selling dock, or you're buying the real estate from the selling dock, or you're leasing real estate from a third party landlord. Those are all negotiable transactions. Now, are acquisition deals delicate? Do you need to be a little careful, a little sensitive? Yeah, you do. You do. Those are a little unique, but it's still negotiable. You shouldn't you shouldn't overpay to the tune of 100 or $200,000 just because you didn't want to negotiate. I personally wouldn't want to.
No,
So
thank you.
no, 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 thank you at all. So maybe a little fun story. I had a client came to me. He wanted to acquire a practice. Him and his wife were going to work together at this practice, and he just was not having any luck with an acquisition. As I got to know him and learn more about his style, his approach, what his vision was for his dental office, he shared with me that both him and his wife wanted their dental office to kind of feel like a coffee shop.
Oh,
They wanted it to have kind of a vibe where it's relaxing and it's in a walkable community, that kind of thing. And I kind of stepped in and said, "Hey, that sounds amazing, but based on my experience, I believe you're going to be waiting a very long time, if not forever, for an acquisition opportunity. There's not many dental offices that have that type of feel, you
good.
know."
Yeah. And verify.
So my suggestion is I think you're going to have a heck of a lot better time doing a startup and finding a lease space or a building to purchase that is in the right zoning, the right part of town, the right vibe that you're looking for. You're going to get a 3, 4, 10-year head start if you just versus just continuing to wait.
Yes.
So, he took my advice. We found a lease space that was right next door to a Starbucks.
Okay.
And he's 4 years in now for his practice, and it's growing incredibly. Their patient acquisition numbers are way higher than they had projected, and he is feeling very good about his practice. He just hired a new associate, new hygienist, and is well on his journey. And I met with him last fall, and he shared with me that he is so happy he decided to do the startup and get his practice aligned with his vision versus kind of making a compromise or continuing to wait, for
Ah,
the right acquisition opportunity. So it all depends on each market. What is it? What is your vision? And what is available in each market? And you want to have a partner who's aligned, who can kind of help you, along the way and maybe make some of those key decisions that can be very influential.
exactly. And you know your market, and each agent knows their market. And that's truly such a huge value. And to your story, they got exactly what they wanted. I mean, it's a coffee house vibe right next to a coffee house. So, what better way to go? And they got to do it all themselves. So, I like that. Yeah, waiting, who knows when that would be available. So, I'm glad that you were able to help them and work with them. And Ryan, it was so good to have you on the show today. We appreciate your expertise and your guidance here on all things real estate. I know there's a whole lot more to learn. So, what's the best way for our audience to get in touch with you and the other agents at CARR?
Yeah. Easiest way is right on our website. If you go to CARR.us,
Okay.
up top, there's a Find an Agent tab. You can find me. Just type my name in there. I'm listed under Michigan or Indiana. I can get you connected with an agent anywhere in the country if you want to connect with me, or feel free to just kind of scroll that tab, go to each state, and you can select an agent that way as well. We've got our whole roster right there for 49 states, and we've got a great squad. We've got a great culture at CARR. We definitely have a lot of like-minded agents that are all very client-focused. So CARR.us, probably the easiest, most simple way to do it.
All right. And you've got the great reputation to back it up. And I'll link all that in the show notes so people can easily reach out and get to your website. And to our audience, we love the questions you all send us. So keep them coming, and we'll keep delivering the content that you ask for. As always, if you want to learn about any of our Polaris expert advisory services, or maybe there's a topic that we haven't covered that you'd like to hear about, you can send us an email to info@polarishealthcarepartners.com, and be sure to visit our website at polarishealthcarepartners.com, where you'll find weekly articles from DeWalker Sinha, our CEO, to grow and support your healthcare business, along with access to all of our podcasts, events, and a whole lot more. Thanks so much for being a loyal listener and subscriber. If you enjoyed today's episode, please share it with a colleague, and be sure to leave us a rating on any of your favorite podcast platforms. We'll see you on the next episode of the Group Practice Accelerator podcast.